Okay, as a part of our AI4Care Summit, we have Srini Mahalingam with us from Gavs. Sir, you were talking about the AI technology into the business and things like that. But first, how is the AI actually beneficial to the common people? Maybe things happen, and like down the people don't understand the importance of AI at all. How do you actually reach out to people, and how beneficial is it for them?
No, thank you for having me here. A wonderful morning. So, when it comes to AI for healthcare specifically, I always say this, right? AI is not artificial intelligence. AI is a augmented intelligence for healthcare. And the reason why I say that is for any other industry, as an user, I'm okay to talk to a chatbot or an artificial person, tracking my status. But when it comes to my health, I always need the touch and feel of a doctor or nurse, right? And that's how I feel satisfied. So, but that doesn't mean that we do not need to embrace AI, right? That's why it's an augmented intelligence. We need to enable the doctors, the nurses, and everybody working within the healthcare ecosystem with the technology and move all the inefficiencies out of their system so that they will be able to serve the patients better. That's why AI is important, and AI is augmented intelligence, not artificial intelligence.
But since AI is already there, now will the touch and feel of the doctors, like how will it actually improve the conditions of the doctors? I mean, how will it actually help the doctors as well as the nurses, as you said?
Okay. AI in healthcare is a journey. And when we talk about AI, especially in healthcare, people immediately think that we are going to do some great fantasies in the clinical world, for the patients, etc. Right? No, that's not the case. There is also a big part of non-clinical operational aspects even within the healthcare, which is where I would recommend that we need to have a strong AI solution to help the doctors and nurses clear away a lot of the inefficiencies. For example, no, the doctors and nurses, they need to be equipped with the technology for them to discharge a patient quicker. Even today, when a patient is ready to get discharged, it takes many hours for the patient to walk after the hospital because of data getting exchanged between a hospital and an insurance. There is a lot of communication that happens within the hospital, etc., etc. Right? AI should predict the previous day that the patient is ready to get discharged. What are the steps 1 to 10 that needs to happen? Line up everything and have the technology enabled for the nurses and doctors, right? So this is just an example, but a lot of such things that needs to be implemented for the clinical staff to feel that they can spend a lot more quality time with the patients.
Now, since it's all on AI, now how safe is the data of the patients? For instance, now you're talking about discharge and all, which means the AI is well informed about the health of a person. How, what about the privacy of it, and how safe is it?
See, data privacy and safety, it's a bigger topic, but then if you see that exists even with or without AI, right? So, what is required here is a very, very strong data governance. And then two aspects, right? The data that resides within an entity, like a patient's data residing within a hospital A, hospital B, and data getting exchanged between two entities, which is data, what we call it as data in transit, data in motion, right? If there is a standards that is being followed, and all the data governance are well in place, I think there is no need to worry about it, right? Especially with JI, especially with the Gen AI now today, what we can do is we can convert the unstructured patient data that resides in a fax, that resides in an X-ray, that resides in any other unstructured format. It can convert them into a structured format, which makes it even better that data can be made safer for the patients.
So, at GAVS, what are you actually people doing?
So at GS Lab Gaps, we serve our healthcare customers across providers, that is the hospitals across the world, payers, the health insurance companies, and the life sciences pharma companies. And what we do is we take them through a pilot phase, thereby the users, they feel the benefit of what they are getting. It could be a doctor, it could be a nurse, or it could be any other staff working within the healthcare ecosystem, right? And again, we do AI solutions on the clinical aspect, like in the supply chain. For one of our customers, we help them to save cost by converting a lot of the pharma components that they were shipping in air, we made them ship them through ocean without any impact to the end product, and that saved them a lot of cost. Similarly, on the clinical side, we help hospitals to predict the hospital acquired infection for the patients. It's going to save a lot of patient lives, right? So those are few things we do from GS Lab Gaps for our healthcare customers. And as I said, it's a journey, a lot more to do.
How receptive are people and the doctors for that matter?
How receptive? There is an initial challenge in the change management because, again, as I said, things cannot happen overnight. But then once you prove the value for them, right? Again, as I said, doctors' time should be spent completely with patients. Doctor's time cannot be spent, documenting something, typing something in a computer, right? His or her time should be fully with patients. If you are able to demonstrate that to our clinical staff, whether it's doctors or nurses, it's easy, right? They will adapt it.
Thank you so much for being on the show. Thanks.